And you mentioned the emergency department, and you guys have also talked about possibly building another new emergency department in the Midtown area. And a couple minutes ago, you were talking about how we want to try to keep more patients out of the emergency room, yes. Which has been kind of the prevailing conventional wisdom in recent years. You want more people seeing their primary care doctor, more people going to urgent care and walk-in clinics instead of utilizing the ED. So how does that line up with this continued expansion of emergency room space?
So it's a good question. And one I've actually challenged my team with, because you're absolutely correct. Right now the Cape Fear campus Ortho Hospital is dedicated to orthopedics, and that is moving over to the 17th Street campus in a new 3-story tower that we're building above the surgical pavilion, kind of a hospital within a hospital concept. So when that happens, what's left at the orthopedic hospital campus is an emergency department and outpatient imaging services. So what do we do with that? What is the right answer for, do we just leave them there? Do we relocate them somewhere else in that area, which I call the Midtown area? And do we replace an ED with an ED? Because if we put up an ED, guess what's going to get used? An ED. Where's the highest cost place to get any care? The ED. And so I've challenged my team to look at, is that just the answer? Is that the knee-jerk answer to just replace it with what we have? Or if we look at the trends in healthcare, if we look at the need to reduce cost in healthcare, to reduce unnecessary utilization of the emergency department, is there a different alternative to put in place other than the way we've always done it? At the same time, from an imaging standpoint, the imaging services at the Ortho Hospital are what's called hospital-based. And that means essentially they're reimbursed at a higher fee. It costs more. Translation. Well, if we're talking about this being a project that's probably 4 to 5 years out from now, by the time we actually finish the Ortho Hospital and then address this Midtown issue, 4 to 5 years from now, do we believe we should be charging the same for healthcare services, or do we need to reduce the cost and make those more market competitive, especially on an ambulatory basis? And does that change the answer of what we replace in our Midtown strategy? And so it's a great question. I have the same question, and I'm hoping my team answers it for us.